And you are now live.
Okay. This is Senate Appropriations Committee, and we're continuing our work on the FY 2023 budget. And we're starting off with a presentation from the Department of Vermont Health Access regarding their budget request for this year. And the Commissioner, if you want to introduce the staff you have with you, and then I don't know whether you want to you have slides that you want to use or whatever, but I'll leave it up to you. But if you want to introduce your staff, that would be great.
Absolutely. Thank you, Madam Chair. For the record, Andrea Delevrier, Commissioner for the Department of Vermont Health Access, otherwise known as DVA. I believe you are familiar with the subject matter experts joining me today, but I'd like to go around and have them introduce themselves. So let's start off with Steve Wisławski. Take it away, Steve.
Good afternoon, Steve Wisławski, DVA CFO.
Alicia's here.
Good afternoon, Alicia Cooper, Director of Managed Care Operations for DVA.
Deputy Commissioner Hoffman, there we go.
Hi, Sandy Hoffman, Deputy Commissioner on the clinical side at the Department of Vermont Health Access.
And Dr. James.
Hi there, Nessa James, Healthcare Director for the Department of Vermont Health Access.
All right, thank you very much. So what we'd like to do today is provide a brief overview of the DVA State Fiscal Year 2023 budget. And there are a few noteworthy items we discussed the last time we Zoomed together, so we'll touch a bit on those. And then I'd like to hand off to DVA CFO Steve Wisławski to walk through the narrative. If that sounds okay, I think we can just jump right in.
It does. Well, this would be your first time presenting to the committee, but because we only have afternoons, we do not go on the ups and downs sheet. I know maybe in your other presentations you go line by line, and we really would like you to just focus on really the bigger items, either on the plus or minus, the big challenges ahead, and so I probably not get into the same level of detail as the House would be able to do. But if you want to start with your slides or however you want to work it, that's fine.
Okay, that's great. And that makes perfect sense. So I'll just do a brief overview. And then Chrissy, if you have just the narrative for SFY 2023, we can walk through that and highlight the important items there.
You have your annual book that you're providing that has all the different sections and everything you ever wanted to know about Title 19.
I call it a cookbook. Yes.
Yeah.
I believe you have copies, and we can direct you to the page when it's time, the beginning of the narrative, if that's helpful.
And I have it ready to go on the screen too when you're ready.
Thank you so much.
Okay. Well, I'm just talking about the normal, the cookbook.
I do believe those were shared. Dr. James, do you have a sense of, it was a bit of a couple weeks ago. Anyway.
It was a couple weeks ago that, yep, they were delivered. So we popped them in the mail to you guys. So I will check to see what happened to those if the committee doesn't have them, because we did receive them about 2 weeks ago.
Okay.
All right.
And then we do have the electronic version posted as well. And the specific highlights that you're looking for, Senator Kitchell, will begin on page 87.
All right. I know, Chrissy, you sent us, was this part of the package you sent us?
This was a standalone packet, different from
I don't remember getting it.
Yeah, I'll follow up
the
on
DVA
that.
book.
Yeah,
I have the two from the Agency of Transportation, but I don't have, but it would be helpful. So I don't have anything to refer to, whatever page, but for the committee, it's just everything you want to know. What are the managed care investments? Who's under what different categories? The match, historical, the spending by provider. And then there's a section specifically on the budget and a description of what the increase, what's driving an increase, caseload estimates and so forth. So it really is a treasure trove of information for those of you who, but I have to tell you folks from DEVA that that's the section of the budget I report. So perhaps I get more excited about it than maybe others might, but
Well, I appreciate your enthusiasm.
we'll let you go. Keep
And just to
going,
let
Chrissy.
the members know that there, you have the full digital presentation in the email I sent out earlier today to each of you, but we're also going to share it on the screen too. And then I'll make sure you actually receive the hard copies of the binders they dropped to us a couple weeks ago.
Okay.
Okay, are we ready?
Mm.
Okay. So I'll just do a brief overview and then Steve will share beginning on page 87, Chrissy, just for your knowledge. So the DEVA SFY 2023 budget that we're here to present today represents $94.8 million in new appropriations with $43.6 million in state funds. As we walk through the narrative, we're prepared to share some updates on the things that we chatted about last time, which are Medicaid caseload, which I believe everyone is very familiar with the increases, as well as utilization. And for everyone's awareness, as you know, as you may already know, it is one of the primary drivers for this increase. And Senator Starr, I can't help but comment on your cat.
Oh,
She's
I'm
very
sorry,
cute.
I didn't think anybody could see it.
I think it's adorable. But anyway, thank
Yeah.
you.
And he should tell you what his cat's name is.
What's your cat's name?
Bum Bum.
You're kidding.
Yeah, she's a real bum.
Love it. Well, Bum Bum can join us anytime.
Mhm.
So we are hoping to hear some information this week regarding the public health emergency and whether or not that will be extended. That does impact our ability to redetermine eligibility. As you know, we have a total number of 206,000 Medicaid members right now, which is 30,000 additional members than we had in March of 2020. We are not able to, per federal guidelines, disenroll members unless they ask us to throughout a public health emergency. So we, again, Steve will have more information about reconvening consensus when he walks through the narrative, but that's the update there so far. And we are also pleased to share the expansion of Medicaid postpartum coverage, which is currently 60 days from the end of pregnancy to 12 months. And we'll share more information about that later as well. And
Yeah,
then
and we
finally,
do have language in our Budget Adjustment Act that related to filing a state plan amendment to take advantage of that coverage. I believe it's for 5 years, and your email was indicating that you didn't think you'd be able to implement that provision until the beginning of next year, if I remember correctly.
that's correct. Beginning of 23. Yes. SFY
Right.
23. Yes.
So what you have is a partial year cost.
Correct. Previously. Yeah.
Mhm.
And then lastly, if you do have questions, you may have seen 96 limited service positions in the big bill that we are requesting to convert rather to permanent positions at DEVA. So if you have questions about that, I'm happy to answer those. So I will stop there. I want to make sure we allow enough time for Steve to walk through the narrative unless you have specific questions for me.
I do have, I think we do want to look at those conversion of positions because our understanding was that I believe it was a little more than 50 positions we were had been added to deal with the limitations of the Medicaid eligibility module of the exchange. And we kind of dubbed it, we have a highly manual automated system. So my question is around those positions, are those 52 or whatever positions needed to support Medicaid eligibility part of that request?
Do you mean, I just want to clarify, do you mean 50 positions prior to this?
No, they've been in place for a long time. And they
Okay.
were required to do the workarounds of
Yes.
the eligibility system. And so we had to,
Yes, you are correct.
there was a very large expenditure and infusion of staff to deal with the lack of functionality of the Medicaid eligibility module of the healthcare exchange. So my question is, they've been there right along
That's correct.
since we pulled the switch. Are they, I would assume, part of your 90?
Yes, yes. So just to clarify, we have a total throughout the department of 133 limited service positions. The 96 that you see in the big bill are primarily related to eligibility, the enrollment and eligibility. There are some other ones in there as well, but these have been established actually since 2012, and you are correct to the idea was that technology would be a solution for the manual effort of people, and it has not proven to be the case. So those grants for those supporting those positions at the time have long expired, and they have been built into DIVA's base budget for years now. So our request, there is no fiscal impact to this request. I think that's important to note, but they do perform essential DIVA business functions, and without them, we'd be in a big trouble. So we're just asking to convert those to permanent. They are, very much integrated into our staff and perform those essential functions. And I envision when the public health emergency ends, we're going to rely more heavily on them than ever before.
I guess the longer term question is, because we're also investing in integrated eligibility, which is a misnomer because it's really Medicaid eligibility. And so one would hope that with that replacement system, that it would reduce the number of staff that had to be put in place because of the inadequacies of what we built into the exchange. So my question is longer term. We're making these you're proposing to make them permanent now, but I'm not sure of the completion date of the integrated eligibility module for Medicaid, but one would hope that it would in fact allow some reduction in the staffing required that was really put in on an emergency basis to address the shortcomings of the old system.
Right, and it's a very valid point. I think that our position on it right now is that these individuals, more than half of them actually have established rights. They're our staff. And we are committed to analyzing our operational needs ongoing. And again, the balance of the 133, as time moves on, if we experience shifts in need, we are absolutely committed to addressing those, but we don't anticipate any changes at this point in time.
And these are currently limited service?
They are, which essentially means.
Well, they have the same
an
benefits
expiration.
as permanent.
That's right. That's right.
I guess what I was getting at, and I don't want to be discouraged, but I was hoping that once we got the system replaced, it would have a beneficial impact on the number of staff necessary to execute the work, because so much of it was compensatory to an adequate eligibility system. That's really the concern that I'm expressing.
I understand. Yes. And so I don't know exactly what the impact of the eligibility system related to the work that these folks do, but I can actually go back and we can look at that a little closer and share information back with you.
All right, thank you. We'll keep going.
So
Did I hear someone?
yeah, could I ask a question?
Yeah, certainly, Senator Westman. I
So-
can't see you, but I can hear you.
Yeah, so what you're saying is the IT system that was originally supposed to take care of this, we have really no hope that it will ever be to a place where it can deal with the workload.
At this
That's
point,
that's my understanding from being on the technology oversight, and also it was also because of the match requirements to build a new system that was this new integrated system, although Access was designed to be integrated and Medicaid eligibility got pulled out back with the federal healthcare reform. So so that's my understanding, Senator Westman, was that basically when we get done, we have replaced that inadequate system that that got developed as part of that exchange.
So most of the work that's being done on the integrated system and the IT system is contractual work with outside contractors. So we're still paying, going to keep the 52 positions on, and I'm just trying to understand the scope of the field. It's quite discouraging.
I can share a little more detail about these what these people do. Unfortunately, we don't have Deputy Commissioner Strumolo with us today, who would really be able to answer the granular questions. But the number of positions that we have in this Big Bill 96, many of them, I think 85 almost, are really responsible for properly enrolling people into, including low-income Vermonters, into health insurance. And that's a lot more complex than what I just stated. There are also a number of folks that are managing the large information technology contracts and initiatives. And then there are a number of member appeals. I think there are maybe 1 or 2 member appeals positions with eligibility that are in this list as well. So they have been on a consistent basis performing essential business function for DEVA since about 2012.
I don't think we're debating the essentialness. I mean, obviously it was such a, and I don't know if you were working.
I heard about it.
All right. So some of us lived through it, and and we ended up just having to sort of plug, the dike and make this system work with all kinds of manual workarounds, et cetera. And I guess what I'm trying to figure out is the legacy. I was hopeful that when we have this new eligibility system, and I've kind of lost track in terms of where we are, in terms of the date where we actually would do the replacement with this new eligibility module. But I was hopeful that it would have a beneficial impact on the number of staff, because one would hope that we would be replacing this less than adequate system and very labor intensive system that we had to throw a lot of workers at to adequately serve Vermonters, that the replacement would yield some benefit on the staffing requirements. That is really the heart of my question.
Yeah.
And generally when positions get added, they don't go away. So I think we probably spend enough time on it, but I guess you can understand our concerns. We're making millions of dollars investment in a replacement module. We'd like to see what will be the beneficial impact on the staffing requirements for it.
And I will connect when later today, I'll connect with Deputy Commissioner Strumolo to understand the impact of the enrollment eligibility system as it relates to the work that these folks are actually doing every day.
Well, just not to, I'm going to beat the dead horse here. We hired the 52 when we were 12 to 14,000 people waiting in line to sign up and couldn't sign up in the exchange. So it is just disappointing.
Thank you for the comment, Senator Westman.
And I guess you can tell some of us have a long memory because we actually were here.
And took the phone calls from people that couldn't sign up for healthcare.
Yeah, it was a very difficult time. All right, let's keep going. We have made it through B306 sort of.
Okay, so I'll turn it over to Steve now for his walkthrough.
Okay.
Could you
Thank you, Commissioner.
also, could you just tell us who's in charge of the integrated eligibility work at this point? Who is the project? Who's leading it up?
Well, Deputy Commissioner Stromolo is really the lead, and she's the best resource for information.
Because it was, last I know was Laurie Collins, but is Laurie retired?
She has not retired officially, and we are working to identify a transition plan for a more permanent lead.
All right. Thank you. Let's move then to the next section.
Okay. I guess just by way of overview, we last convened with your committee exactly 5 weeks ago on January 11th to go over our budget adjustment. And so at that time we had 16 items. Today we're bringing you 17, but the good news is 12 of them are repeats, just with different dollar amounts. And then a bunch of the other items are relatively small and recurring ones that you see from all of the departments. Very quickly, the division of our budget is administrative and program. Administrative is our section B306 appropriation. That's our people, contracts, services, and so forth. And then the much larger portion is the program budget, which is 3 of our appropriations paragraphs, B307, 309, and 310. The differences there are simply what we're paying for and how we're paying for it. B307 is really the big ticket one. That's about 3/4 of DEVA's overall budget, about $750 million that pays claims. So we're in the admin section. That's kind of the people, services, contracts. There are 5 items. I'll just go through them quickly and I'll try to keep track if there are any questions. So item number 1, B306, is the salary and fringe changes. I think you see this from everybody. The largest item here in that 2.6 million gross, 1.3 million state fund up is the increased retirement costs. That's for pension and healthcare or OPEB accrual. And then the others are just salary and fringe. We were directed in budget instruction to break that on 2 lines because I believe there was an incremental increase assumption to the fringe amount. So that's why it's 3 lines together. And that's for the, we're talking about the limited service positions. DEVA's total authorized count is 373 positions. And our current vacancy rate is about 10% of that.
Steve, could you, you have annual salary and fringe.
Mm-hmm.
And in fringe would be the healthcare, because the premium went up on that about 10%. And then we know the increased retirement costs went up because the review showed that the ADAC was too low. And so that was reflecting the higher of the adjusted adjustment to the ADAC payment. What do you mean by incremental fringe?
I'm sorry, that was just we started the budget development process in August or thereabouts and received an assumption for fringe from finance and management. And then during budget development, there was an assumption for incremental. I think that they made some adjustments or we got information regarding, what the actual costs were versus the assumed cost. We were instructed to represent that as the incremental fringe. So the salary and fringe plus the incremental is the total. But I'm sorry, I don't have a whole lot of elaboration on that. I just thought that was how we were to reflect those increases.
Okay. Well, we'll keep going. It's just, I'm not sure incremental on what, but I'll talk to Stephanie about that.
Okay.
Because I think we may be getting a different, I don't know. Just need to, it's very clear here what you're adding for costs.
Okay. All right. Thank you. And I apologize for the lack of the description on that. But I will also circle back with our folks, AHS. Item number 2 is a repeat from budget adjustment on just a different dollar amount. So this is our Vermont Health Information Exchange. And this is just related to the cost allocation, so how we're paying for it. Up to September of this year, it was the Federal High-Tech Act, which is stretched all the way back to the American Recovery and Reinvestment Act of 2009, which was providing a 90% federal share. And with the expiration of that act, we needed to migrate the federal participation into our advanced planning documents. And so this is reflecting, it's sort of two dimensions of change, if you will. One is that federal participation via advanced planning documents is kind of a portfolio of 90% for development work, but only 75% for maintenance work. And then there are categories that aren't enhanced at all that are just at 50%. So it's going from all 90% to a mix of those. And then the other is that the High-Tech Act was, it didn't discriminate as to what was Medicaid versus not. But our advanced planning documents are specifically with, the agreements are with the Centers for Medicare and Medicaid Services. And so they want to see what proportion of the health information exchange is allocable specifically to Medicaid members. And that's about 2/3 of the transaction volume. So there's an additional haircut, if you will, from the 100% coverage under high tech to about 2/3 coverage under advanced planning documents. And so that's you'll see that it's $0 of change. The cost of what we're paying for is the same, but unfortunately the state share of that cost is going up. Okay. Chrissy, I think top of page 87, that's just the breakout of, I'm sorry, 88, I apologize, next page. All right, item number 3, and this is another repeat from budget adjustment. It's the patient access to healthcare information. The phrase is interoperability. This is so that members can access their healthcare information on a personal device, such as a home computer or an iPhone. And Senator Kitchell, you had asked about the cost allocation here, because as you correctly pointed out, 840,000 gross, 420,000 state is 50%, and you would expect to see enhanced funding of 75% for a maintenance effort. And we do anticipate submitting the request to CMS in this summer's annual submittal of the advanced planning documents. And we do anticipate receiving retroactive determination for the 75% share. So I imagine that we'll be adjusting this in the budget adjustment this fall.
Okay, but for now, you're assuming the continuation of 50/50.
Correct, because we don't have it in hand.
Yeah. Mm-hmm.
Okay, item number 4, internal service funds charges. So this is just, you see this from all the departments. This is just
we do.
Yep. And then item number 5 is just the expiry of a grant with Bi-State Primary Care Association, and those activities are going to be subsumed into VITAL, Vermont Information Technology Leaders. And those 5 items comprise our administrative budget, or section B306 changes. Are there any questions before we move to program?
Questions? I don't see any. I don't hear any voices. So we can keep going into obviously where the big money is.
Yes, and this is the biggest one of all. So item number 6 is the caseload driven changes. And as Commissioner Delabriere alluded to, this is also an out of date number. This presumed that this is primarily driven by caseload. So as we talked about, 206,000 members as opposed to 176,000 pre-pandemic. And the question was, when does the pandemic end and the continuous enrollment requirement cease so that we can begin redeterminations and start out processing ineligible members who are currently enrolled in Medicaid. This assumed that the public health emergency, or PHE, ended January 16th, which of course it didn't. It was extended to April 16th. And we actually anticipate today, but I am not aware that we've heard yet whether the Biden administration intends to again extend the public health emergency or to terminate it on April 16. So we're kind of waiting on tenterhooks to hear that. And then this Friday, we are, as the commissioner alluded, Joint Fiscal Finance and Management, AHS and DEVA, are going to get together and reopen the consensus forecast process. But we really do need that data point today, hopefully, or maybe a little bit later this week, as to whether the public health emergency is going to be extended, because that continuous enrollment requirement, which is one of the preconditions for us to continue to receive that 6.2% enhanced federal Medicaid assistance percentage, or FMAP, it requires us to basically not disenroll anybody from Medicaid. So
it's still advantageous to take the higher match even with this requirement.
That's, yes, we're getting another 6.2 percentage points of federal that's displacing the state share. So
right. So, but I'm sure that part of the calculus is we're carrying a much larger caseload than you anticipate. I think because we're doing that sort of, you've estimated what that portion of the caseload is that would be terminated once that requirement not to do redeterminations goes away. And so I'm just off the top of my head, I don't know, how does the cost of that higher caseload compare to the gain we get from the FMAP bump?
See,
and Stephanie can probably tell me that.
Yeah, and Senator, this is where I have to defer, because I always have to remind myself as well that the total Medicaid spend is almost $1.6 billion, and DEVA's barely half of that. So this is really, and I don't think the AHS central office was able to join us today, but this is where I defer to AHS, because they really do need that picture of like all of the departments that spend Medicaid dollars, not just DEVA, from the state level.
Okay, we'll keep going. So this is, we know that this is subject to change, and a lot depends on when we move out of that federal declaration.
Yes, that's exactly right. Okay, Chrissy, I I forget where the page break is here. I think we might be, there we go. Maybe just quickly on the bottom of page 89, almost all of this changes in our section B307. This is the global commitment dollars, but there are tiny allocable pieces in state only for VFARM. That's actually a down, and then an even smaller piece is non-waiver, and that's just related to the CHIP program, Children's Health Insurance Program, which is going to be a federal and a state share as opposed to just a single global commitment fund piece. So the overall number is almost entirely global commitment, but there are other little portions of it. All right. Okay, item number 7 is just a straight repeat of budget adjustment. This is related to the Brattleboro Retreat contract, and this is a transfer, an agency net neutral transfer from the Department of Mental Health to DEVA. 13 million gross, so that dollar amount is the same as it was in fiscal 22, but the state portion is just a little bit different because of the slightly different FMAP rate for fiscal 23 and 5.7 million state share. And I have received the question I should probably review. You would think that section B309 state only would mean only general fund. However, we do have to classify global commitment investment dollars in our state-only appropriation, and that's specific. $9.5 million gross and 4.2 million stayed is allocable to individuals who are subject to the global commitment investment cap. And that's forensically involved individuals and individuals with stays longer than 60 days.
Mhm, mhm.
Okay, number
It
8.
seems like as you've gone into payment reform more, as you see it, money's being transferred. And of course, you do rate setting for nursing homes, and now you're doing rates for DMH. I guess where Dale is going to be doing rates for IDDS population. It seems like DEVA is really the place where all of that analysis and work around these payment models is being done. I'm just making it seems like that's what I'm seeing here, is that the expertise to around these payment models, and it's really falling to DEVA to support, and that's where the expertise is. But it seems like we're seeing it here with DMH on the retreat, probably seeing it with Dale relative to IDDS. And of course, we've got rate setting, and rate setting got moved to DEVA now. So you have a lot of rate setting. Just a comment.
Okay, yes, because if there were, just Dr. Alicia Cooper, that would be her wheelhouse, if you will. And there is a rate item. There are a couple rate related items coming up. So
no, I'm not talking about increases in the Medicaid reimbursement per se. I am talking about as we're moving into alternative ways of paying for healthcare services and getting into different payment models. It seems like other departments within the agency DEVA is supporting that work on behalf of those populations. That's all I'm saying in terms of the payments that are going out to those provider entities. But maybe you're not doing that work, but that's my impression. And I guess
Yes.
Alicia Cooper can respond to that, but it seems, it does seem, it makes sense if that's where the expertise, where the systems are, and to really do that rate setting analysis and those different models resides. It doesn't make sense that every department replicate it. So I just am seeing that reliance on DEVA expertise for other departments in setting those rates.
I'm happy to comment briefly. We have certainly appreciated the ability to work with the other departments within the agency on a number of these initiatives to look at alternative payment models. And I think, as you said, we've been able to develop some best practices by having gone through it on earlier projects that we can then bring to the discussions with other departments as they contemplate these efforts going forward. So we're trying to do that in the most efficient way possible and collaboratively across the agency.
Okay. Number 9.
Yes, so this is the annual counterpart to the number that you saw in budget adjustment, which if memory serves was about 4.7 million gross, with a correspondingly smaller number for state. But it is the same cohort of Medicaid annual rate adjustments. The reason that the number in budget adjustment, because of course the rates, the idea was to start the rate adjustments January 1 of this year, which would be, half of a fiscal year. The reason the number in budget adjustment was less than half was that till we actually start getting, the requests for payment, there's a lag of about a month and a half. And so our budget adjustment assumption was for about 4.5 months. This $12.5 million is for a full 12 months, the full fiscal year 23.
And And this would be to bring those payments and align them with Medicare.
More closely, so yes.
Yeah.
Dr. Cooper.
All right. Now, I don't know how to interpret your last sentence here. Because of continued pressure on DEVA's budget resulting from increased caseload, DEVA will not be able to continue to support rate increases aligned with established methodologies unless funding is appropriated for this purpose. Is that an argument for why you need the 12.5 million, or are you saying you've got a problem separate and apart from that?
That is reiterating why we would need this 12.5 million.
Okay. Thank you.
All right. And then item number 10 is just the emergency department per diem rates. And this number, it's another repeat from budget adjustment. And the number you saw then was 250,000 gross. This is 500,000 gross, exactly double that, 219,000 state. And again, this is to provide a per diem rate for individuals who are awaiting placement in a psychiatric facility, and does have oversight from the department as far as payment authorization.
So DEVA has the clinical oversight, not DMH.
I believe that's correct. I think Deputy Commissioner Hoffman can address that in more detail.
Yes, it would be both. Both would have clinical oversight.
Oh, by the departments then. Okay. Questions? I don't see any. I'm just looking. If not, we'll keep going on to page 91.
Okay. Item number 11, yet another repeat, and you do see this one every year.
I do want to go back on your earlier one about those per diems. When the budget adjustment came over, there was language that had been put in by the House that was instructing hospitals to use those per diems to make hospitals more appropriate settings for people having mental health emergencies. And we struck that language because we recognized the per diems were needed by the hospitals to support the care. And the issue wasn't, really the long term was that the emergency rooms weren't the right place to be treating. And so we were asking a system that was really having to address the care needs, even though they acknowledged it wasn't the most appropriate place clinically, but it was the default place based on the reality to undertake when they're already stretched, to undertake modifications to make their ED rooms and use this funding source for that purpose. I don't know if you were aware of that language or not, but anyway, we did not, we moved to strike it when we passed the BAA. All right. Were you aware of the language?
I sorry, I was not.
No, I wouldn't think you would be. It's more from a care perspective, but.
Yes, Senator Kitchell, we were made aware of the language.
I've talked to a lot of, a number of people in hospital emergency rooms, around the state, whether it's UVMMC, whether it's our local hospital, Porter, et cetera. And they were just tearing their hair out because they cannot refuse a patient. And they were, they were, as a result, feeling that the system's inadequacy to supply the right beds in the right environment were just by default, they were having to cope with something that that really was not by design, but just, as I say, just because they had no other choice. And so I don't know how we will end up with that language, whether the House is adamant that it goes back in. But I think our concern was that that it really needed to, the attention needed to be placed on how to avoid the inappropriate use of emergency rooms for this population for a prolonged period of time. So maybe, I don't know what the agency's position on it is, but around the language, but just to let you know, we removed it.
Thank you, Senator Kitchell.
So let's keep going here to buy-in and caseload changes.
Yes, so item number 11 is related to our purchase for dual eligible individuals, folks who are eligible for both Medicaid and Medicare, of Medicare Part A and Part B. And about 95% of the budget is Part B. That's the more expensive of the two. And a lot of individuals already have Part A by virtue of their employment history. And in November, CMS announced a very large 14.5% increase starting in calendar year 2022. And so that is almost the caseload. I mean, obviously, we have more people on the rolls. That will drive a slightly larger number. But the real driver here of that $9.6 million gross, $3.9 million state up is the 14.5% increase. And before testimony, I did look because there had been, Secretary Becerra had directed CMS to revisit that rate increase because, as I understand, it was driven largely by the increase of, I'm going to pronounce it wrong, but I think the Aduhelm drug, which subsequently, I guess, had a cost reduction, about a 50% cost reduction. But as best I can tell, the verdict won't be rendered for a few months yet. There really isn't, they aren't making any promises as to whether, they will definitively have the rate revisited during the session.
Is that a drug that has to be administered in a hospital setting?
I don't know the particulars of the.
I was just wondering why it was popping out here as opposed to the Part D.
It's just that, as I understand that, the authorization for that particular drug was what was driving that 14.5% increase to Part B. And the Health and Human Services Secretary had directed CMS, look, that's a big increase. I want you to, revisit that and see if, you can't bring that increase down. But I just don't have any information that will know when or if CMS is actually going to do that. So it's just a flag, Senator, that, we'll keep our eye on it, but it may be something, if it does come to pass, if there is a corresponding reduction to that 14.5%, it'll probably have to be in budget adjustment next fall. Well, I mean, in budget adjustment development for next session. There may be hope, I guess is the point.
Okay.
High
tech.
Okay, high-tech nursing. Again, this is another item that's exactly twice what you saw in budget adjustment, 304,000 gross, 134,000 net. And this is related to high technology equipment like dialysis machines that need to be operated by an RN or licensed practical nurse as opposed to a home health aide. Next item, small dollar amount. This is just a transfer from the Department for Children and Families to DEVA for providing care, emergency care for foster children who are receiving services from non-Vermont Medicaid providers. If DCF pays for the service, it's subject to the global commitment investment cap. If DEVA provides the service, it's just straight global commitment, hence the transfer. Item number 14, this is a 3% increase for assistive community care services, 507,000 gross, 223,000 state. And this is to align the ACCS providers with the designated agencies and special service agencies with DAO. Okay. top of page
Jane.
90. I'm
I
sorry.
want to, yes, Senator Starr, you want to go back to 306?
Well, I think
307.
You brought it up earlier about, the 3% and how they arrive at that amount. When everything else is going up from 5 to 10%. Maybe we could get an explanation of how they arrived at 3% for the DAs in that group.
Well, that 3%, I'm not sure the DEVA folk can speak to it. I think what they're doing is just, this aligns with,
Everything else.
ACCS is a part of the long-term care choices for care, which now it got folded into the global commitment budget. I guess what you're hearing expressed here is what we're seeing is a 3% proposed increase by the governor for the community-based providers that are either providing mental health services or the IDDS services or the care services for people with who are elderly or with disabilities, and a 3% increase in this environment where there's a workforce shortage, where the state of Vermont itself is recognizing a need to increase its compensation, salary, and benefits for state employees by over 10%, that we have here, and I'm not directing it just to DEVA, I'm directing it in a general way. We're asking these agencies to provide care, meet their increased operating costs, compete in a work environment where there's shortage, where if they're providing, for example, running facilities and having to purchase food, a 3% increase is really, it really is reflective of the priority in which those providers are regarded. And our view is 3% is basically design. If those systems are weak and fragile now, a 3% increase will only worsen the situation. That is the concern. And that is not, we know that you've given a target. We know how some of us know very well how the budget works. But I think in the larger scheme, to be presented a 3% increase in this environment and the role that we expect these providers to carry out and to do well is not particularly realistic, or the impact is either not understood, or they just within this administration, those services aren't a priority. That's the way it feels. And so we know that we're going to be getting, and we're starting to get it from all the entities, how impossible it is to deliver the services with this recommended increase. And so the ball has been thrown into our court to figure out a remedy. And that's, I think, what we're feeling right now. And you don't even need to respond because you have to defend the governor's budget. But if anyone wants to provide testimony that we think that we can strengthen these agencies, help them with their workforce, their salary requirements, meet the increased cost of food with a 3% increase, then I'll invite you to testify to that fact. Otherwise, we just know it's how to get to the budget that you're presenting. But it's a dilemma as it comes to us as we try to construct the budget for 2023.
Yeah.
So I'm going to suggest, I've given you my mini diatribe on that, but it's not a great position to put us in because the money has been used for other great things. And then everybody's going to say, well, this was a wonderful, and you're not, we support it. And people do not understand if you're wanting to give something more in one place, or you want to give tax breaks, it's a zero-sum game, and you have fewer revenues, and the impact pops out somewhere. And this is obviously one place it's popping out. So we'll move on to postpartum coverage. But that's what Center Star is talking about, because we're hearing from our VNAs, we're hearing from our adult A's, we're hearing from our AAAs, we're hearing from our DAs, we're hearing from our Youth Service Bureau, we're hearing from our PNMI facilities. And so that's what's being expressed here. So let's move on to page 92, unless somebody else wants to add anything more.
Madam Chair, I just wanted to make just a short comment that we wholeheartedly do not feel that other services are not prioritized. You know, we really don't feel that way. We are doing everything we can, or that we feel is in our control, to offer rate increases or adjustments where possible. But again, your points are well taken. So thank you.
And I'm not asking you to respond. I know exactly the position you're in. We're just letting you know the position it puts us in as we're trying to address all these competing needs. And we will move on to postpartum coverage, and we already support that. And this is just this is assuming that you'll be able to implement in January of next year. Is this is it a 6-month cost, or is this a full year cost?
Yeah, this is the full year, and I don't know, Dr. James, if you wanted to speak to this in any sort of operational detail as to how we might propose going about this or implementation.
Well, I just wanted to say that I remember from the email that I got from the commissioner, in that you didn't feel you could operationalize, do the systems work to implement this benefit until the beginning of next year. And that's why I was asking whether this is a partial year cost, but it looks like it's a 12-month, even though you've acknowledged that you probably won't have it implemented until the last half of the fiscal year.
Senator Kitchell, your memory amazes me that you can recall that email. You have it exactly correct. The one comment that I would make is that, yes, we had said that in order to have it completed and ready for early calendar year 2023, we do have to make those system and operational changes. And so that's part of the fiscal development that you're seeing presented in this budget.
But this is the cost of the benefit itself.
This is, so when we're able to have it implemented, obviously, as you acknowledged, we still have to go through the Medicaid state plan process. This is what we had estimated the fiscal impact to be for this postpartum coverage extension for the full 12 months.
The reason I'm asking is to clarify, because in other words, we don't need to annualize this figure for whomever is going to be here for FY 2024.
Yeah.
Clawback.
Yes. So this is clawback is Medicare Part D, right? So this is the prescription drug benefit. The states, receive lower costs as a result of participating, but the federal government wants a big chunk of those savings back. And so this 3.7 million, this is also, it's entirely state funds. So this is one that resides in our section B309 state only appropriation. And it's a sizable up this year because, last year we paid with a 6.2% FMAP enhanced global commitment dollars on the front end, and it reduced our clawback on the back end. And this is assuming that, for the entirety of fiscal 23, we're not going to have that enhanced FMAP. I suppose if the PHE is extended and pushes the the FMAP into a quarter of 23, this could be revisited. But right now, this number stands.
Okay. And then,
And
any
then
questions on clawback? Otherwise, we can move to CHIP. Okay, don't see anybody.
All right.
And
CHIP
I
is-
can only see 3 members of my committee. So if you've got a question, please speak up, but because I can't necessarily see you. Okay, CHIP.
Okay, so this is the last item, and it's a small one, and it's just changes to the Children's Health Insurance Program federal Medicaid or federal medical assistance percentage. And fortunately, this is actually an increase in the federal share, and so there's a corresponding decrease in the state share for the allocable portions of our CHIP-funded programs. So this is in section B310 of DEVA's appropriation, and that's the non-waiver.
Yeah, it's outside the waiver. Yeah.
Right. So,
Okay.
so no change gross, but it's an increase in the federal, and an increase in the state.
Yeah, we like that.
Yes, absolutely.
Other questions about that? This is one of our funding streams for Dr. Dinosaur. It's behind the scenes. Vermont, unlike other states, didn't create a SCHIP separate program for higher income kids. We have just one healthcare program for kids, and then behind the scenes, there's Medicaid funding and the regular Medicaid, and then there's the CHIP funding. So I think if that's no questions, then we can pull down the screen. Okay, committee, any questions? My goodness, it's a lot. It's obviously a big area of spending, and certainly provides healthcare for a lot. The only thing that wasn't talked about, and that is the fact that you've identified or estimated the savings or the cost of the Medicaid program that is being driven by not being able to do redeterminations and terminate coverage. And so believe that there's a one-time, was that about 9 million or something, Steve, was estimated? And so we're using some one-time for that caseload in anticipation that once that federal bump goes away, that those do not represent ongoing costs. They're just, they're time limited, driven by whenever that federal requirement is in place. Does anybody, that's my understanding. Is that right?
Yeah, and I apologize again because I believe that question came up in House and AHS answered that one, but that sounds about right. That sounds similar to my recollection.
Okay. So, so where does that money show up? That one time.
I don't know that that would be an hour. I'm going to have to defer that one, Senator.
Well, I'll talk to Stephanie. We've had some conversations, so I'll find out. I mean, I know the global commitment has to flow through the Secretary's office, but and is the federal, it's appropriated twice. But I was just wondering where the one-time money for that caseload segment was showing up.
It's in the governor's list of one-time general fund expenditures.
Okay.
He has it as its own standalone.
Okay. Thank you. That's all I was asking. Where is it?
I'm sorry. I was.
It's there.
It is. It exists. It's accounted for.
All right. Any other questions? I guess I'm looking, all set. Okay. Well, then, we're actually 15 minutes ahead according to the schedule. At 2:30, we have Natural Resources Board. So unless we have other questions of the folks from DEVA, I will suggest we let them get back to their, well, I should ask, is there something we should have asked that you didn't want us to ask?
Yeah,
I think I can think of a long list, but no.
Well, I probably, if I tried.
Well, we really appreciate your time today. I know it's a busy time for all. So thank you for having us today.
Okay, thank you. Chrissy?
Yes, I am here. We have Sabina Haskell with us from the
Uh-huh.
Natural Resources Board, and I've just zipped a note to Holly and Brenda from the Financial Division to join early. So I've just zipped them a note, but we do have Sabina here.
Okay, I think she pronounces Sabina.
Sabina, I apologize. We unmute her so she can join us here.
Uh-huh.
It's okay, I'm used to it.
I will never make a mistake again. I do apologize.
It's okay.
I just got a note back
Although,
from Holly that she's going to join
Isn't
us.
it the Sabine women,
It
or is
is.
it the Sabine women?
Well, it depends on who you ask, but yes, that's what it's from. Yes.
Yeah. Mm-hmm.
My goodness, I recognize that voice.
How are you, Senator Sears? I'm glad
I
to
am
see you.
fine. Good to see you too.
Yeah,
in
a long
person.
time. Yep.
It has been. Just got an email from the Bennington Banner. Now they email me with questions. No, they don't really work at it anymore.
Oh, you know what I would do if I was still there?
What would you do?
I'd say, no, you have to call him.
Yeah. Thank you.
No, because if you have to respond by email, then you've done quite a bit of the writing already.
Exactly.
Uh-huh. That's what I would do. Chrissy, we had a couple of bills while we're waiting for other people to come on. We had a couple bills referred today. H1, is it S173 or?
I'll take a look and see what's in our in and out of committee. And do you want me to send you a little list?
Yeah, because we probably ought to see about spinning out some bills.
Okay, great. And just so you know, Holly and Brenda Berry have joined us. So we have the full complement for Natural Resources Board.
You know, can I say something, Jane? With regard to the
Yes.
bills that came, S188 is regulating cannabis, but I think they said on the floor it went to finance. And the one that came to us was 173.
Mhm.
But was cannabis supposed to come to us?
Well, I thought that, I don't know. I thought that went to finance because I believe that's the fees.
yes, it went to
Um,
finance.
But 173 came to us and because it creates some subcommissions and so forth. And that's it has to do with the State House
Right.
Committee. So that shouldn't take us too long. If we have a little bit of time, we could squeeze it in.
Okay.
And then we have the Parent-Child Center Network bill and a couple others. So we just need to allocate some time to, and any bill that's got an appropriation, we'll just move out like we do and strip out the appropriation until, because the Parent-Child Center bill has got the appropriation, that base increase they want, plus the one-time funding.
Right.
Okay. So now that we have the full complement, we'll take up the budget, recommended budget proposal for the Natural Resources Board. So I will turn it over to you, Sabina, to present the budget request.
Thank you so much, Senator Kitchell, and thank you to the committee as well. I am Sabina Haskell. I have been the chair of the Natural Resources Board since December 13th. And so I have brought with me Holly Anderson and Brenda Berry, both with the Agency of Administration, who stepped in and helped the NRB earlier in the fall, develop the budget, and because we are also without a business director at the moment. So I am going to be passing the baton to them to answer most of your questions, but I thought I would highlight a couple of things for you that in last year, in calendar year 2021, the team received over 500 applications, and we made decisions on 438 permit applications, which is pretty good. Pretty good. We're deemed complete, and we made 442 decisions, is what I should have said. So it was a busy year for everybody. We published our annual report today, so I can send you links to that, the link to that as well, and share that with you. And I'll do that afterwards, and I can send it to Chrissy if that's the appropriate next step.
Mm-hmm. That would be great. Thank you.
Okay. And I would like to be able to pass the conversation over to Holly and or Brenda, however they want to proceed, if that's all right with you.
Mm-hmm. That's fine. Do you need screen sharing, or do you have a document you want Chrissy to pull up?
I believe that we provided it to the committee, but you tell me what you want us to do. Oh, there we go. Thank you.
If everybody's ready, I can, Sabina, if you're ready for me to go over the budget, I can do that.
That would be great. Thank you.
You're welcome. Good afternoon, committee. For the record, my name is Holly Anderson. I'm the CFO for AOA Financial Services Division. We were approached last fall, as Sabina mentioned, by Finance and Management and asked to assist NRB with preparing their budget documentation. So much of this work was done with the former chair, Don Rendell. So we do a lot of departments. AOA Financial Services does about 14 different departments. So it was more of the same type of work. So we're happy to help Sabina out, and hopefully we don't have too many in-depth questions, but we will do our best to answer anything that you have. The heart of the budget is on page 7. If you want to go down to page 7, which is the crosswalks. So the NRB is made up of general fund and their special permit fund. This fiscal year, we are asking for an increase of 6.6% in general fund and 3.9% in special permit funds. The 6.6% increase in general fund, you'll see highlighted here, the first 3 rows are all related to salary and benefit changes. This is pretty consistent that you've probably seen in a lot of the other testimonies that have provided. One thing new for the NRB this year that is kind of in the numbers is that top line where it says net expected vacancy savings. So the total budget pressure for salary and wages was around $236,000, but they do have a $50,000, $221 vacancy savings amount offsetting that pressure. And I believe that's because of all the vacancies that they're trying to fill now. And also the ISF, so the Internal Service Fund increases. In the budget instructions, we were instructed to budget for a 3% increase, but we all know that some of those ISFs came in higher. So what this increase represents is a 7% increase in Internal Service Fund amounts, billings. The next 3 lines are all savings, and they're primarily operating savings. So when I looked at the detail of what makes up these primarily are IT related costs. So licenses, mainframe, server type costs, and looking at, looking through my working papers with Dawn, this wasn't particular to a specific IT project or anything. This was really aligning those expenses up with what the actuals were for 2022. So, and 21. So it's more aligning the budget to where the actual expenses are going to land. It's pretty self-explanatory. I don't know if you have any further questions about this? Well, I'll pause there.
Committee? I do have a question. The board, the work of the board, there are special funds here, and those would be for the permit applications.
That is correct. Yep.
And when was the last time those fees were adjusted? Is it the same as all the rest? They haven't been since in this administration?
I will need to get back to you on that, Senator Kitchell.
Okay.
I apologize. I don't know.
Well, I think what we're seeing here in any of the, certainly AOT is the big one because of the fees associated with registrations or licenses or whatever, but not having the revenues and supporting the work, then the cost falls beyond the user of the service to all Vermont, to all taxpayers. And so that's why I'm asking the question in terms of the fees.
Yep.
Because the costs don't go away. Obviously, you're having to meet your salary, you're having to meet your internal service fund cost, et cetera. And if your major source of revenues have remained static for 6 years, the gap is being filled by increased need for general fund in order to keep the board operational. So that's Holly, I guess that's one calculation. I'm not sure that that's on the list of fees that we did that were identified. But the question really is, what are the revenues from the permit application fees, and what would they be if they had been adjusted?
Okay, I will have to look into that. I know we were looking at fund balances, Senator Kitchell, and we were with finance and management, and they did let us know that the revenues were coming in higher than expected. So, looking at fund balances from year to year, I think from 2020 to current, they have increased. So, but I still don't know. I'll have to look at the calculation on if they were increased, would that be sufficient to cover all these budget pressures and costs, increased costs?
And I'm not necessarily saying I'm recommending that as chair. I'm just saying I would like to see how that looks relative to, the general fund need here.
Can I?
Yes, Senator Westman.
So if you're having a fund increase, it must mean that there's more projects coming in, and that means there's more work. And what I don't see, and maybe you're going to get to it, is there is a request to for 3 positions to deal with the ARPA work and some of the infrastructure work that is anticipated to be coming down the pike. So really, and where would I see that, or are you going to get to it? And the question to follow up, Senator Kitchell, is if you're seeing an increase in your in the revenues coming in with the same existing fees, it means there's more projects out there. So how much more pressure is that putting on your budget?
Well, how much more is it putting on your staff?
Yeah, there you go.
Like I can tell you that the actually related to the salary and wage portion of this budget, the staff are allocated a 20-80% split, 20% between general fund and special fund. So it's not that there's additional projects, it's just the allocation of staff are split up that way, at least for those first 3 lines that hold the majority of the increases here. So that it doesn't mean that there's necessarily new projects. It's just the allocation of staff to the different funding sources.
So that you make reference to the 3 positions, Senator Westman.
Yeah. Yeah,
are you talking about for the board? I'm just not clear.
I think.
You want me to jump in?
Yes, please.
Oh, okay. In the governor's 23 budget, he has called for 3 additional limited service positions for the NRB for 3 years, with the intention that that to be focused on the ARPA spending and expediting ARPA projects and making sure we don't lose those federal funds. And 2 of them would be a district coordinators and a program director to oversee the entire work of the district coordinators and the permitting process. I think, Holly, you said to me that our fees were on track. We were fine at 20 for fiscal year 22. We were on track to what we predicted. And I do know anecdotally from the staff that they're beginning to see an uptick in projects, to your point, Senator Westman.
So we have to create those positions. You haven't made reference to that. So perhaps you could explain a bit more, because that obviously, is that included then in the, are those positions? I don't see how you can accommodate those positions within the, they must be funded some other place than the 56,000.
The governor has put in his FY23 budget an additional just over $1 million for the NRB for 3 years to staff for those 3 staff positions.
And
I think it's ARPA. I believe it's ARPA funding. So it's not listed here. It would be listed here in the budget request.
Okay.
But we would have to appropriate the ARPA funding. So where would we see that?
Good.
Probably in the one-time ARPA request list, which we haven't really gotten to.
Yes, I think that's correct.
But the people to answer about those 3 positions would have to be from the NRB.
Yeah, so we might as well ask them right now.
That's what I'm doing.
Okay, so I apologize. Are you asking me what those 3 positions would be doing as their jobs?
Senator Westman.
I think we need to figure out what their jobs are in relation to the work that you're already doing. Now is the time to make the case for why you need those positions, what they are, and it would be helpful for our committee to have an understanding of where the money that's being recommended to us would be coming from. Because if we as a committee are going to approve that, it has to relate to the work that you expect.
Yep.
And it's not the question is not based on that we don't want to give it or approve it. The question is, we need a full picture.
Yep. So the expectation is that with $1 billion or so of ARPA funds coming due and needing to be obligated by 2024, that there will be more projects that will come under Act 250 review, and that we want to have 2 more district coordinators that will be able to spread out over the expected increase in work, so that the ARPA projects can move as quickly along as our regular projects do, and that it'll provide extra resources for that work that needs to happen. The program director would be a position that would oversee the entire program of the district coordinators and the district technicians, to make sure that the work is moving along at the progress that it's supposed to. And so it's a opportunity to make sure everything's staying on track.
I guess what we're having a need to better understand, because we understand there's money in the governor's capital bill, how we use the 113. There's also money, under the state financial relief. And the analysis behind it. In other words, the governor is proposing X amount of ARPA to go for projects that would theoretically or have been identified as being subject to Act 250. How many projects is that? How much money is being allocated by? And I'm not expecting you as board chair to answer that. It's something that we really need to get from the administration, and because those are only funding proposals at this point, and we don't know what the subject matter committee will be, or the extent to which they are skewed one way or the other relative to the categories that we had in the FY 2022 budget, in terms of the 250 million for this and 200 million for that and so forth. So that, I think, is what we're struggling with. Is your budget presentation is one part of this larger discussion around the work ahead, and how you quantify that potential workload over that period of time. Because a lot of these projects, I believe, I believe the governor before wanted to allocate all the money. And so if we basically appropriate it and allow it to be spent over the next couple of years, the question then becomes, how does that workload and those Act 250 applications flow? Are you going to get just a big slug all up once? Are you, how are those projects anticipated to be brought online? I think that's what Senator Westman's asking for, is that kind of analysis of the workflow and the funding. Senator Westman.
And knowing that this has come in the backdrop of with the staff that you've had trouble keeping up, and the staff has been, quite frankly, the portrayal has been that the staff has been stressed at keeping up at the present workloads we are. So, what's the picture that will create getting all of this done in the direction that the NRB has to go?
I guess the other, which I don't have a sense, Rich, for example, in natural resources, on the Act 250 changes, the extent to which, if they're implemented, will influence that workload.
That's correct.
We don't know that yet. So
we're talking about making changes to relieve the NRB and relieve the Act 250 process if we move projects into downtown and creating a pilot with that. So it's hard for us to, but the portrayal that we've had up to this point in the pieces around that is that you have had a backlog. And where is the NRB? Are you up to date with everything? That's the other piece.
I would say that about 70% of the permits do get decided within 60 days, a couple of months. There are the outliers, and then there are the very large outliers, depending on the applicant and whether the permit has gotten its other necessary permits from ANR or from municipal. But 7 out of 10 isn't bad. And
no, this is not really a question about how many you get out the door, how fast.
Right.
Because
so
I'm not really I'm not the amount of work that has to go into this. How would you characterize the workload of the people that are working in the Act 250 process and where they are?
Okay, everybody's working really hard. And when you ask me about what the projects will be that will be coming, we don't know yet, because it hasn't happened yet. But we went in with the observation that we thought we could do it with 3.
Okay.
And that I'm sorry, I can't be more specific than that. But to your point, if there are designated downtown areas and, PHPs and things like that, then that will get pushed, that won't be an Act 250 problem, if you will, but there'll be other things that will be.
So the 3 would be added to what is the existing staff level now, Sabina?
We should have 25. We're at 22 right now. We had 4 vacancies when I joined, and we filled 2, and we got 2 more to go.
Okay. And you talked about someone who would be over the coordinators.
Mm-hmm. So that person.
Do you anticipate, the reason I'm asking is we have gotten different jurisdictional opinions on the same project by, by 2 different coordinators. And it raises the question, and I guess if we're talking about equitable treatment and consistent review of applications, it would seem that that kind of difference of opinion in terms of what the rules are and how they're applied could be reconciled internally rather than having this public disjuncture that this coordinator ruled this way and another coordinator in another district ruled you're not subject, you are subject. And so do you envision that that position would help so that there would be that discussion in terms of how that determination was arrived at by the 2 different coordinators and come up with some agreed upon interpretation of the rules and the application?
That would certainly be my goal. Yes. Yes, that person will be able to bring consistency and clarity and predictability to it. Yes, absolutely.
We've raised that before and we were told, well, that's the beauty of Act 250. You have a difference of opinion by region. But if I'm a business and I'm doing business that might have projects in 2 different areas and I get one decision one place, and then it becomes very hard to explain or to justify or to predict. I guess that's the reason that I'm raising it again. We had that certainly that issue with the Moyle Valley Rail Trail, and that ultimately got resolved by the federal government weighing in and saying you don't have jurisdiction here at all under the federal rules. So that's that. But the reason is the consistency and predictability of the application and the determinations that are made. That has, I think, been a source of concern when you get different opinions. And we do have businesses that obviously their projects are going to be in multiple areas of the state. And with ARPA, that possibility increases even more. And that's why I'm asking the question in terms of what that position would do.
That is definitely what that position is designed to do, Senator Kitchell.
Okay. Other questions? Okay, Brenda Berry is in the background. Do you have anything that we should ask you, Brenda?
I don't think so.
All right, well, I don't want to not offer you the opportunity. Other questions that the committee might have? Okay. I think at some point this raises, we need to sit down and have a briefing on all those one-times because they really are relating to other, to the budget requests that we're getting, because it's it would be more efficient. And thank you, Senator Westman, for raising it in this context, because it's a lot easier to do it while we've got the witnesses right here and can discuss it as part of the 23 considerations. It's just where it happens to be lodged in the budget.
Yeah, because it has to do with getting the workload done over the next year, and you can't get the picture unless, if you're hiring 3 positions on top of 22, that's a big deal.
Well, we have to create them first.
No, I get it.
Yeah. Okay, other comments or questions? If not, thank you. And
thank you very much.
We'll see how some of these bills that might influence your workload, how they materialize.
Yeah, thank you very much.
Okay, thank you.
Take care.
Thank you.
Bye.
Bye.
So our next still remaining 15 minutes ahead, and we have the Agency of Education. Chrissy, do you have something?
Correct. They are expected to join us at 3. So would the committee like to take a little break and reconvene at just before 3 to take up education?
I think that would be a good idea. We'll go offline and take a 15-minute break.